Senator Di Natale.
Thank you, Mr President. My question is for the Minister representing the Minister for Health, Senator Ludwig. The Four Corners program last night broadcast what those of us with a health background have known for some years, and that is that the threat to global health posed by superbugs and antibiotic resistance is a severe and urgent threat. In a few short years, minor infections and routine surgery could become life-threatening conditions. What is the government doing to prepare Australia for the worsening problem of resistance and to safeguard the future health of Australians?
Minister representing the Minister for Health, Senator Ludwig.
Thank you very much, Mr President. I thank Senator Di Natale for his continued interest in antimicrobial resistance, or commonly named as AMR, and drug-resistant tuberculosis in Australia. The government is concerned about the emergence of organisms that are resistant to antibiotics and the implications they may have for healthcare delivery in the future. The importance of effective and sensible use of antibiotics, Mr President, was highlighted in the ABC Four Corners program, as mentioned by Senator Di Natale, and the government is pursuing this goal through our investment in the National Prescribing Service, which provides independent advice on the quality and use of antibiotics. The Australian Commission on Safety and Quality in Health Care have taken the lead on this issue since 2006, and the recent establishment of the Antimicrobial Resistant Subcommittee is a welcome partnership between experts and government, and as I understand it, the Minister for Health will be meeting with them on Wednesday to discuss this important issue. It is a matter that is certainly on the agenda for the Health Minister. The government also remains committed. There are further work we can do in the region as well. It is important to recognise that antimicrobial resistance, AMR, to antibiotics does delay or prevent recovery from infection and limit antibiotic treatment options. That's why the government has taken these necessary steps to look at this particular issue. Should I not raise the level of concern or alarm in the broader public, this is a matter that is and has been on the radar for some time. AMR has increased over time, and it is one that is regarded in the health care area.
Senator Di Natale.
I thank the Minister for his comprehensive answer. In 1999, the Joint Expert Technical Advisory Committee, known as JEDICA, on antibiotic resistance was established to make recommendations to government on the threat of antimicrobial resistance. Can the government confirm that over a decade later, most of the recommendations have still not been implemented and that there's still no systematic collection of data on antibiotic use and on the prevalence of antibiotic-resistant organisms in Australia?
The Minister.
Thank you, Mr President. I thank Senator Di Natale for his answer, for his question, I should say. It is an area where in the brief does not provide an explanation over the last report that he mentioned, which was some 10 years, so it would predate this government. I can say that which I mentioned in the primary question, which there were two bodies, one, the Australian Commission on Safety and Quality in Health Care, have taken the lead on this issue since 2006, and the recent establishment of the Antimicrobial Resistance Subcommittee. Those both bodies, the subcommittee and the Commission, are clearly working on this issue, and the Health Minister is and certainly has it on her radar. What I can say is I'll take on notice on the specific points that you raised within those recommendations and see if the Health Minister can add further to the answer that I have provided today.
Senator Di Natale.
Thank you. My final supplementary to the Minister is that in June the government funded TB clinics on the Torres Strait Islands of Boigu and Sabai were closed in favour of AusAid support to Western Papua New Guinea for treatment programs. Has the government conducted any analysis of the threat to public health that the closure of these clinics represent and what it might mean for the likely incidence of drug-resistant TB in Australia?
The Minister.
Thank you, Mr President. I thank Senator Di Natale for his interest and continued interest in the issues around drug-resistant tuberculosis in Australia, but particularly in the overseas in PNG. Can I outline this first, as the government also remains committed to working with PNG through our aid program to ensure improved healthcare delivery to PNG nationals, implementation of best practice care models of TB care, as recommended by the World Health Organisation, requires local services and community-based models that can provide a continuous care. Can I then add that in terms of providing additional information in relation to that specific question, I will seek additional information from the Minister for Health if she can add anything to it. I do understand that in terms of closures of TB control centres, the Queensland Government has announced that the Queensland TB Control Centre will remain open.
Time has expired.